Presenting another informational video by Diabetic Supply. Hypoglycemia, also known as low blood sugar, is a common concern for people with type 1 diabetes. It occurs when the level of glucose in the blood drops below normal levels. This can lead to a range of symptoms such as confusion, weakness, sweating, and seizures. In this video, we'll explain what hypoglycemia is, why it's a concern for people with type 1 diabetes, and how it can be prevented. What is hypoglycemia? Glucose is a type of sugar that comes from the food we eat, and it is the primary source of energy for the body. In people with type 1 diabetes, the body cannot produce insulin, which is a hormone that helps the body to use glucose from food. Without enough insulin, the glucose cannot be absorbed into the body's cells, causing it to build up in the bloodstream. This can lead to hyperglycemia, which is high blood sugar. When people with type 1 diabetes take insulin to manage their blood sugar levels, they must be careful not to take too much, as this can cause the opposite problem: hypoglycemia. Hypoglycemia occurs when the level of glucose in the blood drops below normal levels. This is usually below 70 milligrams per deciliter. This can happen for several reasons. One reason is taking too much insulin, delaying or skipping meals, or exercising too much without adjusting insulin dosage. Why is hypoglycemia a concern for people with type 1 diabetes? Hypoglycemia can cause a range of symptoms, such as confusion, weakness, sweating, and seizures. If left untreated, it can lead to more serious complications, such as coma or death. For people with type 1 diabetes, hypoglycemia can also be a warning sign of an impending episode of hyperglycemia. This can lead to long-term complications such as kidney disease, nerve damage, and eye problems. Preventing hypoglycemia in people with type 1 diabetes. Preventing hypoglycemia in people with type 1 diabetes involves a combination of careful monitoring, medication management, and lifestyle adjustments. Here are some tips for preventing hypoglycemia. 1. Monitor blood sugar levels. People with type 1 diabetes should monitor their blood sugar levels regularly, at least several times a day. This can be done using a blood glucose meter or a continuous glucose monitor, CGM, which can provide real-time data about blood sugar levels. By monitoring their blood sugar levels, people with type 1 diabetes can adjust their insulin dosage or food intake to prevent hypoglycemia. 2. Adjust insulin dosage. People with type 1 diabetes should work with their healthcare provider to determine the right insulin dosage for their needs. This may involve adjusting the dosage based on their blood sugar levels, food intake, and exercise routine. It's important to avoid taking too much insulin, as this can cause hypoglycemia. 3. Eat regular meals. People with type 1 diabetes should eat regular meals throughout the day to help prevent hypoglycemia. Skipping meals or delaying meals can cause blood sugar levels to drop. It's also important to eat a balanced diet that includes carbohydrates, protein, and healthy fats. 4. Adjust insulin dosing for exercise. People with type 1 diabetes who exercise regularly may need to adjust their insulin dosage to prevent hypoglycemia. Exercise can cause blood sugar levels to drop, especially if the insulin dosage is not adjusted. It's important to work with a healthcare provider to determine the right insulin dosage for exercise. 5. Carry snacks. People with type 1 diabetes should carry snacks with them at all times in case of hypoglycemia. This can include glucose tablets, fruit juice, or other quick sources of carbohydrates. If hypoglycemia symptoms occur, a snack should be consumed immediately to raise blood sugar levels. 6. Avoid alcohol. Alcohol can cause blood sugar levels to drop, and it can also interfere with the liver's ability to release glucose into the bloodstream. People with type 1 diabetes should limit their alcohol intake or avoid it altogether to prevent hypoglycemia. 7. Wear medical identification. People with type 1 diabetes should wear medical identification, such as a bracelet or necklace, that indicates they have diabetes. This can help others recognize the symptoms of hypoglycemia and provide appropriate care in case of an emergency. In addition to these tips, it's important for people with type 1 diabetes to work closely with their healthcare provider to manage their blood sugar levels and prevent hypoglycemia. This may involve adjusting medication dosages or making lifestyle changes based on individual needs and circumstances. Treatment for hypoglycemia. If hypoglycemia occurs, it should be treated immediately to prevent more serious complications. Treatment typically involves consuming a quick source of carbohydrates, such as glucose tablets, fruit juice, or a sugary drink. Once blood sugar levels have stabilized, a more substantial snack or meal should be consumed to prevent hypoglycemia from recurring. In severe cases of hypoglycemia, such as when a person is unconscious or unable to eat or drink, emergency medical treatment may be necessary. This may involve administering glucagon, which is a hormone that can raise blood sugar levels quickly. Conclusion: hypoglycemia is a common concern for people with type 1 diabetes, but it can be prevented with careful monitoring, medication management, and lifestyle adjustments. By working closely with their healthcare provider and following these tips, people with type 1 diabetes can manage their blood sugar levels and prevent hypoglycemia from occurring. If hypoglycemia does occur, it should be treated immediately to prevent more serious complications. Thank you. Visit iBuyDiabeticSupply.com for your extra supplies.